So I'm grateful now to Simon, who's our current president of SCTS, and a long-term trainer, and with many awards, European awards, as well as local awards. But he's going to talk to us about the challenges of newly appointed consultants and how we might be able to address these as a mentor of a newly appointed consultant. Thank you, Simon.
Thank you. Thank you. Can you see my slides there?
Yes, thank you.
That's lovely. As I prepared for this talk, I reflected, as a medical student, consultants were demigods. They were faultless, and you had no insight that they were human even, really. You couldn't believe they would have problems. And then as you go through your training, you're aware of the variation amongst your surgical trainers and some of the different styles. And then as a junior consultant, you began to be aware of people being suspended and getting into difficulties. And over the years, you gradually take in the fact that any group of humans seems to have issues in the teamwork, in the way they're interacting. And it becomes very, very sad to see very intelligent, very motivated, very able people who are getting into problems which affects their professional lives, affects their personal lives, affects the team that they work in. And by accident, I've become involved in supporting colleagues. But I wish that I'd heard people like Lucy talking when I set out, so I could have done it with more insight and more skill. So I'll briefly just talk about my experience and my observations of mentoring consultants. Obviously, you're asked to be a mentor, not because things are going well, but because things have gone really badly. Hopefully before, as Shyam says, before they're suspended, because suspension is an awful sanction, and it's very hard to get back from that. The issues are very complex. They'll have been going on for a long, long time. You'll rarely be asked to be a mentor for an individual who is not part of the problem. They will have a style, they will have done things that probably have contributed to the issue. And sometimes they have insight and sometimes they don't. And of course, very rarely are they part of a team that is functioning well anyway. So it's not like they've been a problem and their team is all perfect. It's often that they're doing a lot of things well, but they're in a team that's not performing well, not interacting well, and they've become a victim of that mistrust and disorganization. And in general, trusts do not have a system that can deal with these things. If they did, then you wouldn't get to the point where external help is needed. But there just isn't the time or the resource in the NHS to support teams to prevent these things happening. So I think as a mentor, and you've alluded to this, Mahmoud, a sincere wish to help the individual. I don't think you should be doing it just for sport. I think a genuine wish of success. I think you need a reasonable professional experience. It's not something you can do in your junior years because you won't have the knowledge of the dynamics for the individual and for the teams. You need to know what good looks like, because if you don't, you can't help the mentee aspire to where they should be getting to. And already mentioned, you should be trustworthy and have integrity. One of my favorite questions in these group sessions is, what's the difference between empathy and compassion? And as the more I say it, the more of you will know the answer. But a torturer can have empathy because they know the pain they're inflicting. But compassion is where you really care about how awful that pain is. And so I think it's very important to have empathy as a mentor, even better if you've got compassion as well and can feel how awful it is for the person you're trying to help. We've already mentioned a lot about being a good listener, and you need the ability to have a conversation with your mentee where you can talk about what's happened, how it's happened, why it's happened, how they've done it, and to challenge whether they could have done it better. You certainly need to have a lot of time, because you need to do a lot of listening, and particularly in the early weeks or months of the mentoring, you need to have a lot of time, and that can be by Zoom or by physical meetings. If you're in remote trusts, then you can meet halfway, or if you're traveling down there for another reason, you can meet up, but be flexible, be responsive, and keep confidentiality, absolutely. And the reason it takes a lot of time is because you need to hear about all the history and the context of the issues. Is it about competency, surgical competency, professional competency? Is it about professional jealousy? Private practice can often come into these issues. The personal style of the individuals, is it a background culture where they think they're being nice and polite to people, but other people perceive them as being domineering and uncaring? Is it about someone becoming isolated in a team without realizing that they were becoming an outsider? Have there been previous complaints about them? You know, it can even go back to the method of their appointment, that a colleague can be appointed on the whim of part of the team, and that actually they are always resented because of their appointments right back at the beginning. So you need to gain an understanding of the history and the context of the issues. And then you need to find out from the mentee what they're really aspiring to. You know, do they really want to get back to being part of this department? Do they want to be part of the team? Or are they looking really to move out or retire, or to get even and get equal with what's happened to them? So more listening, try and talk about what's happened, why it's happened, try and get them to have an insight. Ask them how we could have got to a different situation, and try and get from them if they have insight and reflection about what's happened, because often with all of us, it's our lack of insight that have contributed to the issues. It's interesting not just talking about the problems, but also the impact it's having on their family, the strain on the relationships. You know, are they having enough annual leave? Are they still taking exercise? Are they still doing their hobbies? Are they still taking holidays, which was an option before COVID? But it's important not just talk about the issues that are central to the problem, but also about their wider well-being. And then there's other support that you want to gauge from them. You know, have they got colleagues in the surgeons that they trust, that are supporting them? Are there anaesthetists, any cardiologists or thoracic surgeons, respiratory physicians? Sometimes there are very active managers who understand these issues and can support them. And of course, in the extreme circumstances as well, they may be looking for BMA support and also their defence organisation. My experience at defence organisations is that they seem to want to perpetuate the problem rather than bring it to an end. So I'm never quite sure. I think they've almost got a conflict of interest. I'm never quite sure of their good support. And so far, all I've seen is the BMA being quite passive in their support. I don't see them being actively supportive of people in trouble, but that's my limited experience. So when you've got the history and context, when you've got the aspirations of the mentee, then you want to sort of start to listen to them and trying to form a plan of how to get them to where they want to be. And certainly with the people I've been involved in, it's been really planning to detail those first key meetings in getting back into the team, getting back to work, how to address that first meeting with the clinical director and the medical director, that to go into that meeting with a BMA representative at your side, looking to fight over detail, looking to try and be seen to win on previous points of detail is not the way that you're going to ingratiate yourself with your trust. That if you can get the mentee to appreciate that going in with humility, reflection, a willingness to engage, a a willingness to change and be part of the team, you are likely to be accepted back into the team. And that you're showing a willingness to seek help and be collaborative is really important. The other way to get the mentee to understand a way to get back into work is to consider what the alternatives are. You know, what do you expect to win if you continue to fight? And to get them away for the points of detail of he said, she said, or, you know, that patient didn't die because of that, etc., etc. Get them away from the detail and get them to think of the bigger picture. And try and get them to understand that it is very difficult to win once you're on as an outsider and get even. That if you want to get back to work, you need to show humility and show change. The other key bit of advice that I try and help people with is the real importance of getting an emotional connection with your chief adversaries. So that they usually are people that are identified, surgical colleagues, managers, clinical directors, and the importance of just having the ad hoc meeting of saying good morning politely, of popping into the office, sharing things away from the problem like families or politics. Just get that emotional connection and break down the barriers that have made the mentee an outsider. I think being a mentor for consultants is a long-term commitment. Initially, the meetings are frequent, they are long, and as the weeks and months go on, if things are going well, then they become less frequent and less long. The confidentiality is forever, and that should never be broken. And overall, I think mentoring consultants is very challenging, but can be very rewarding. If you can get someone back working, back professionally content, that is a great piece of work to have achieved, and worth doing. So I'll stop there, Mahmoud, and as ever, happy to take questions. Thank you.
Excellent. Thank you very much, Simon, for that, for your insightful comments and experience. One of the points you've raised was about confidentiality, and you know, in the guidance from the College of Surgeons, I said that unless, obviously, but you agree with that there are conditions where you would break confidentiality, obviously, if it involves patient safety or anything else like that.
Yes. Yeah, you would have to, but that hasn't come up as yet. But that would be a very difficult dilemma, and I think you'd have to be open with the mentee if you had to break that.
Yeah, thanks, Simon. That was a very practical, presentation, and it clearly comes across. You've been involved, in several of these or quite a few of these, and the experience comes through. Simon, the question I have is, you clearly articulated the role of mentorship once there is a problem. I wonder what your thoughts are, to mentor new colleagues and younger and newer consultants, because they're inherently, they're likely to be competent at doing their job, okay, at finishing training, although I know some colleagues have some concerns about that. I do recognize that. But they're clearly going to be less experienced, and will not be having the wisdom and the ability to make decisions in complex things. And I wonder the role of mentorship as a preventative mechanism for people getting in trouble. And then we avoid all these serious issues, which are clearly very, very harmful to the individual, patients, teams, trust, etc., and become more complex, more difficult, and more challenging to address. So what do you see the role of assigning mentors when younger and newer consultants get appointed to units Rajesh, please.
You are right. That is so important. because ideally all these human teams, whether it's lawyers or dentists or physicians or surgeons, you have good styles of leadership and support where you get that mentorship within the team. But as you say, that doesn't necessarily happen. And before you get problems, to provide junior colleagues with external mentorship to talk about what's happening, why it's happening, advise them how to keep out of trouble, will be really supportive for them. It is. I'll go back to what Shyam said. It is awful if someone gets to the point of suspension, and the more good support they have early on, the better.
This is the vision I personally have for this mentorship scheme, is that every newly appointed consultant will have the opportunity to have a mentor for the first, whether we agree 3 years or 5 years, which is the most dangerous period in a consultant's life, and for going into trouble. And that mentor will be there available for them to advise them and support them. And this is why when you register for this course, you were asked if you would be happy to mentor consultants or consultants in difficulty or trainees. And we hope to have a list of, once we run this course a few times, to have a good list of senior consultants who are happy to be mentors for junior consultants, and start pairing them up regularly. Any new appointed consultants will be offered to have a mentor. Obviously, as we said, they have to be not coerced into it, and they have to accept it for it to work. So they would be offered a mentor from this scheme to support them through their first few years. And thank you very much, Simon, again for a very insightful talk.